Good day, and welcome to this advanced lesson on clinical pathophysiology. The Clinical Pathophysiology is a course for advanced practice nursing and midwifery. It has been developed to equip nurses and midwives with the depth of scientific understanding required for advanced clinical decision-making. As nurses and midwives transition toward advanced practice roles, they are expected not only to recognize clinical problems, but also to understand the biological mechanisms driving those problems. This course provides a structured, clinically focused exploration of how normal physiology becomes disrupted by disease, and how those disruptions present in real patients. The course is designed to strengthen the learner's ability to interpret symptoms and clinical signs through underlying mechanisms, anticipate disease progression and complications early, integrate pathophysiological reasoning into patient assessment, and management communicate clinical reasoning clearly within multidisciplinary teams. By combining foundational science with applied clinical reasoning, this course prepares participants to think, assess, and reason at an advanced practice level, forming a strong intellectual base for further clinical training and specialization. Modern healthcare environments require nurses and midwives to manage increasingly complex patients, many of whom present with multiple coexisting conditions, altered physiology, or rapidly changing clinical states. While basic nursing education introduces disease concepts, advanced practice demands a deeper and more integrated understanding of pathophysiology. Many clinical errors and delayed interventions arise when clinicians are unable to link symptoms, vital signs, and laboratory findings to the underlying disease processes. Clinical pathophysiology enables practitioners to understand why a patient is deteriorating, distinguish between similar clinical presentations with different causes, predict how disease processes will evolve if untreated, make informed, safe, and timely clinical decisions. For nurses and midwives preparing for advanced practice roles, mastery of clinical pathophysiology is essential. It underpins diagnostic reasoning, guides therapeutic decision-making, enhances patient education, and strengthens leadership within clinical teams. The Clinical Pathophysiology for Advanced Practice Nursing and Midwifery course is grounded in the belief that effective clinical care begins with understanding. Advanced practitioners are distinguished not by memorization of diseases, but by their ability to reason through complex clinical information, identify patterns of physiological dysfunction, and make decisions based on mechanisms rather than assumptions. This course promotes a philosophy of mechanism-based thinking, encouraging learners to move beyond surface-level descriptions of illness to a deeper comprehension of how disease alters normal bodily function. The training emphasizes on understanding over rote learning, clinical relevance over excessive theoretical detail, logical reasoning over guesswork, acknowledging that nurses and midwives practice in diverse and sometimes resource-limited settings. The course also fosters adaptability, teaching learners how to apply strong reasoning even when advanced diagnostic tools are unavailable. Here is a guiding principle. Advanced practice is built on understanding how disease disrupts normal physiology and how those disruptions guide clinical care. Thanks for watching. The course overview continues in the next session. See you in the next video.